This video will demonstrate the technique for the sampling of blood from a peripheral vein. Begin by consenting the patient, sanitizing your hands with alcohol gel, and preparing the equipment needed. The equipment that you need is shown here, but it is important to familiarize yourself with your local institution's equipment, as well as with the type and amount of blood bottles needed. I will now demonstrate the procedure, and a more thorough explanation will follow shortly. It is important when taking blood that you familiarise yourself with the bottles needed and their recommended fill lines. In some cases, it may be possible for the laboratory to undertake tests on bottles which are underfilled, but other tests, such as coagulation studies, require a very specific amount of blood in them and will be returned and rejected if they are not filled correctly. It is important to follow your local institution's recommended order of draw when taking multiple blood tests, as this can avoid cross-contamination of preservatives within the tubes. This varies by location and is usually found where you get your phlebotomy equipment. It is important to have a steady hand while taking bloods, so that the butterfly does not dislodge from the vein. If it cannot be held as is, a finger can be placed on top of it, gently pressing it against the skin as shown. When the bottle has been filled to the recommended fill line, it is important that it is inverted multiple times to allow for adequate distribution of the preservative fluid throughout the sample. When all of the blood samples have been collected, the butterfly can be removed and placed into the sharp spin, and a piece of cotton wool can be taped onto the insertion site to prevent further bleeding and to reduce bruising. It is important that the blood samples are then labelled at the bedside, and that the patient's identity is confirmed against the labels, both verbally with themselves and with their wristband. To look at this process in more detail, after the ideal vein has been selected, it is sanitized using an alcohol wipe, rubbing in circular motions. Allow the skin to dry as you select your butterfly. Ensure that the bevel is facing up and hold the wings in a way that is comfortable for you. Use your non-dominant hand to stabilize the vein as you insert the butterfly at approximately a 30-degree angle. A flash may or may not be seen depending on the equipment. Stabilize the butterfly against the skin and insert your blood bottle into the bell of the collection tube. A flow of blood should be seen. In this mannequin, the flow is not continuous, and this does not reflect real-life circumstances. If this is seen in a real-life patient, it may suggest that the butterfly is not within the vein. Once the bottles are filled to the recommended fill line, they are removed, inverted a number of times, and placed back in the tray. Once all of the sampling has been complete, release the tourniquet, place a cotton bud onto the patient's skin and remove the butterfly. Tape down the cotton bud. Ensure that the bloods are labelled at the bedside, thank the patient, and then send the bloods to the lab as soon as possible. This has been a demonstration on peripheral venipuncture and blood sampling. Thank you very much for watching.